Teratogens, radiation, and chemotherapy. The World Health Organization defines radiation as the release of energy in the form of moving subatomic particles or electromagnetic waves. Numerous naturally occurring radioactive compounds that are present in soil, water, air, and in the human body are the source of natural radiation. People consume and absorb radiation on a daily basis from food, drink, and in the air. Teratogens are substances that disrupt the fetus structure and the function. Physical, chemical, biological, and infectious and genetic factors can all be teratogenic. One frequent and well-known physical teratogen is radiation. Studies have demonstrated that the effect of radiation on the fetus is associated with the week of gestation of the exposure, the dose, and the duration of exposure. Radiation may be divided into two main categories, ionizing and non-ionizing. The ultraviolet region in the electromagnetic spectrum illustrated in the electromagnetic spectrum is where ionizing and non-ionizing radiation split apart. Non-ionizing radiation is defined as radiation in the ultraviolet band and at lower energy to the left of the ultraviolet band. Ionizing radiation is defined as radiation at higher energies to the right of the ultraviolet band. Lower frequencies are reached when we travel to the left of the visible light spectrum in the image. We define frequency as the rate at which these waves rise and fall. The energy decreases with decreasing frequency. Infrared microwave, radio waves, and mobile phone range radiation are all found at these lower frequencies on the left side of the electromagnetic spectrum. We will focus on ionizing radiation and its effect on pregnancy. What is ionizing radiation? Ionizing radiation is a type of energy released by atoms that travels in the form of electromagnetic waves, gamma or X-rays, or particles like neutrons, beta or alpha. The spontaneous disintegration of atoms is called radioactivity, and the excess energy emitted is a form of ionizing radiation. Unstable elements which disintegrate and emit ionizing radiation are called radionuclides. It is commonly recognized that the physical and chemical reactions that accompany radiation's passage through living things are what cause ionizing radiation biological effects on humans. Sequential alterations occur during these processes at the molecular, cellular, tissue, and entire organism levels. Radiation exposure may occur through internal pathway when a radionuclide is inhaled, ingested, or otherwise enters into the bloodstream, for example by injection or through wounds. External pathways, airborne radioactive material, such as dust, liquid, or aerosols, is deposited on skin or clothes. In the following points, we try to express enormous ranges of radiation exposure, which can be obtained from various sources. We can see here that the chest X-ray has only 20 microgray, and the danger dose which poses serious threats for the fetus is 50,000 microgray. There are three types in which a pregnant woman can be exposed to ionizing radiation. Planned or medical need-like radiodiagnosis, which include X-ray, CT scan, and fluoroscopy. Nuclear medicine example is the PET scan, radiotherapy, in breast, cervical, and thyroid cancer. Next is the existing or occupational, in which the pregnant woman is working in the radiology department of the hospital or a nurse administering chemotherapy for a patient. Lastly is the emergency or accidental exposure, like the Chernobyl disaster in 1986, where many pregnant women were exposed to radioactive contamination. This image illustrates the radiation exposure of the upper body parts during pregnancy. The figure illustrates examples of brain, thyroid, and breast cancer. The highest dose of radiation is focused on the tumor, the red solid lines, but scatter beams with low radiation dose, the red dashed lines. Divert away from the tumor. Curved black lines indicate abdominal shielding, and double arrows indicate the distance from the radiation field to the fundus. These are the fetal risks from ionizing radiation. Deterministic effects have a cause and effect relationship such that below a certain threshold, the effect will not occur. Congenital malformations, lower intelligence quotient, mental retardation, microcephaly, various neurobehavioral dysfunctions leading to increased risk of seizures and growth retardation, and fatal death. Stochastic effects occur by chance and do not have a threshold. Childhood cancers are primarily the result of stochastic effect, as seen in the post-Chernobyl disaster with the increased thyroid cancer occurrence. The table here explains how the effects of gestational age and radiation dose on radiation-induced teratogenisis before implantation. 0 to 2 weeks after fertilization, death or no consequence may occur with the estimated threshold or the lowest dose of 50 to 100 mg. And organogenesis happens 2 to 8 weeks after fertilization. The effects are congenital abnormalities of skeleton, eyes in general at 200 milligrams. Growth restriction may also occur at 200 to 250 milligray at this stage. In fetal period, which is 8 to 15 weeks or the first trimester, severe intellectual disability, intellectual deficit, and microcephaly. In the second trimester, there's a low risk of severe mental illness. The following are the protective factors to ionizing radiation while pregnant. Inform your physician when you are pregnant and will need medical imaging or will receive radiotherapy. The doctor will adjust the dose, provide appropriate shielding, or delay the procedure. The practice of 10-day rule, which states that whenever possible, one should confine the radiological examination of the lower abdomen and pelvis to the 10-day interval following the onset of menstruation. The acronym ALARA stands for as low as reasonably achievable. Practice the 3 key principles for keeping radiation doses ALARA when you are a pregnant radiation worker. Keep your time in a radiation field to a minimum. Maximize your distance from any radiation source and make sure to use proper shielding.
Chemotherapy describes the use of medication to treat or control cancer by killing cancer cells. It is one of the most widely used methods to treat cancer, along with surgery and radiation treatment. Because chemotherapy spreads throughout the body and kills cancer cells that have metastasized, spread to sections of the body far from the original primary tumor, it is referred to be a systemic treatment. Chemotherapy is administered in many ways: orally, intravenous, injections, topical, intraarterial, intrathecal, and intraperitoneal. These are the common substances that are used for chemotherapy, most causing abortion and stillbirths, but imatinib and lapatinib are producing teratogenic effects. Data about the ultimate outcome of children who have received in utero chemotherapy looks reassuring despite the fact that studies are limited and findings have been acquired on a small number of patients without being able to define the degree of evidence using the scale. The table summarizes the main effects of chemotherapy on embryo and fetus development. The only dosage that poses risk and might result in pregnancy termination is during the gestational stage of conception. Malformation in 7 to 70% of children born to mothers receiving a single drug and 25% in cases of combination therapy. Second or third trimester has case reports of reversible fetal heart toxicity for treatment with anthracyclines, particularly when trastuzumab is associated in the regimen. Malformations are as frequent in children born to healthy mothers. Pregnancy termination is not necessary when the disease is detected in the second or third trimester of gestation, or when it is feasible to postpone the start of chemotherapy past the 14th week. In these cases, the fetus is not at high risk of serious complications. Protecting the fetus with the dangers of chemotherapy involves several strategies. Delay the treatment until the second or third trimester. Avoid conception during treatment and avoid being pregnant within 6 months after chemotherapy. Using a condom can stop chemotherapy drugs from reaching the fetus through sexual contact if a pregnant woman's partner is receiving the treatment. Pregnant nurses should take precautions to avoid exposure when caring for a patient undergoing chemotherapy. She should wear gloves and a gown to protect herself and should avoid handling the chemo drugs directly. If possible, she should also avoid being in the same room when the patient is receiving the treatment.